Let me tell you why you're here. You're here because you know something. What you know you can't explain, but you feel it. You felt it your entire life. Unfortunately, no one can be told what the Matrix is. You have to see it for yourself.
And they are at capacity. CBS 2's Kevin Rincon has a look inside.
Patient beds line the hallways at Brookdale. There's physically no more room as every inch of this building is now being used.
Well, this is a war zone. It's a medical war zone. Every day I come in, what I see on a daily basis is pain, despair, suffering, and healthcare disparities.
Dr. Millette works in the emergency room where over 100 coronavirus patients have walked through, with another 70 people under investigation.
This virus there's no difference. It has nothing to do with age, has nothing to do with lack of access to health care, has nothing to do with socioeconomics, race, or ethnicity. This virus is killing a lot of people.
And like everywhere else, Dr. Millette says they're in need of a lot of things, including supplies.
We need prayer, we need support, we need gowns, we need gloves, we need masks, we need more vents, we need more medical space, we need psychosocial support as well. It's not easy coming here when you know that what you're getting ready to face.
This hospital has 370 beds, but that is not enough. Not only are they running out of room for the sick, they're running out of room for those who have died. The morgue is filled. A refrigerated trailer is now parked outside for overflow. One thing they have been able to do is develop rapid testing in-house with the ability to conduct 300 tests per day. But in order for things to improve here, they need to see fewer patients. So the message continues to be stay home so they can do their jobs.
They're fighting a war here and they're losing. The sheer numbers of people succumbing to the coronavirus is overwhelming every hospital in northern Italy. The staff are working flat out trying to keep these people from deteriorating further. They're trying to stop them from dying. This isn't an intensive care unit, it's an emergency ward. The ICU is full. People have only just arrived here and they're in terrible shape. This is an absolute constant. This killer pandemic is virtually out of control. The patients are literally gasping for air. The plastic bubbles the staff struggle to communicate through attempt to equalize the air pressure in the lungs. Nobody expected this. Nobody thought they'd be treating so many so quickly. And it's not like flu. It is chronic pneumonia, and it is killing hundreds each day.
There are now 15 patients.
The doctors say they've seen nothing like it before and are warning other countries, especially the United Kingdom, that they will see it as well.
People who keep describing this as like flu, it's worse than that.
No, it's totally another thing. I think most pneumonia than flu. Mm-hmm. Because most people get pneumonia. And as I said before, it's a very severe pneumonia, and so it's a massive strength for every health system, because we see every day 50 to 60 patients who come to our emergency department with pneumonia, and most of them are so severe they need very high FiO2 of oxygen, and so we have to reorganize our emergency room and our hospital in 3 levels of intensity, as you saw.
This is the main hospital in Bergamo in Lombardy province. It's one of the most advanced hospitals in Europe. But it's the most hard-hit of all the hospitals in Italy. The town is the center of the epidemic here. This isn't a ward, this is a waiting room. Wherever you go, people are on gurneys, in corridors, in meeting rooms, they're everywhere. All the medical staff urge other nations to see what's happening and lock their nations down right now or face this.
what I would suggest is just shut down to stop all the outbreak and not come in this kind of situation that is very, very difficult to manage.
How's the person you've been?
I never feel so stressed in my life. I'm an intensivist and I'm quite used to, intense movement and choices, and people are critical and will die without any, treatment, and you make the difference. But when you arrive at this point, you realize that you are not enough, and maybe we are 100 anesthetists here. We are doing our best, but maybe it's not enough.
We are performing the test for the nasal swab to detect coronavirus.
The problem facing health services across the world is that when the infection curve goes up, it rockets. And all the resources, all the testing, all the supplies are used up instantly. Multiple hospitals all at once.
What's staggering is that Italy is doing a lot of testing. Thousands upon thousands being tested. So far, about 4,000, the numbers keep changing, have actually completely recovered. The crucial point is that about the same number are dying. They're sort of neck and neck. And it seems you either live and recover, or you don't. Something nobody expected.
Bergamo wanted us to see this to show what a catastrophic emergency nobody has experienced before looks like. Here they're calling it the apocalypse. And this is what it looks like. Their message to us is simple. Get ready.
Concern is also growing for doctors and nurses working tirelessly to help COVID-19 patients and contracting the virus themselves at an alarming rate. 140 employees at one hospital alone, the Brigham and Women's in Boston, testing positive. Matt Gutman has much more on that story this morning. Good morning, Matt.
Hey, good morning, Michael. Given their daily exposure, I suppose it's not surprising that healthcare workers are getting sick. But here's what's disturbing. Experts are now telling us that the viruses are like poison, and the higher the dose, the more fatal it can be. And so higher doses combined with poor protective gear, making for a dangerous combination. Frontline health workers themselves are turning into patients at alarming rates. It's being called an epidemic within an epidemic. 20% of COVID-positive patients in Ohio and Minnesota are healthcare workers. In Boston, over 700 healthcare workers testing positive. They are exposed to the virus more than anyone else.
Every day when I go to work, I feel like a sheep going to slaughter. My colleagues and I are writing our last will and testament.
Experts say it's not just the frequency of exposure, but also that healthcare workers are exposed to larger doses of the virus as well.
When you get exposed to a virus, your immune system immediately starts mounting a response. At the same time, the virus starts spreading within the body. An outcome depends on which wins the race, viral spread or the immune response. When you start with a high dose of virus, it gives it a head start in the race.
Meaning the virus can overload the immune system of even the healthy. People like Frank Garbin.
And by then, his breathing was almost non-existent. And when their paramedics arrived, they tried to revive him for about 45 minutes.
Garbin wasn't just any COVID patient. The 60-year-old was an ER doctor, the first in the nation to die from COVID. His best friend, Deborah Lyons, on the phone when he passed.
He also knew exactly when he got it. He knew it was those 4 shifts that he had to use the same mask. He knew it.
What do we want?
Shortages in protective gear triggering protests in California and Kansas City. Nate is a nurse in New Orleans.
What are the biggest shortages you're seeing on the day-to-day?
I think we're short gowns, obviously, the disposable isolation gowns. The N95 mask. We're using masks for 5 to 7 shifts generally.
Reusing the same masks over and over. Masks are stored in those brown paper bags on those racks. But even when they do have proper protective gear, medical professionals can fall ill.
I did everything right, and I still came up positive, so I'm not really sure what's going on there.
Infections here in the U.S., 911 operators in New York City say they're on pace to receive as many 7,000 calls just today. A hospital in the borough of Queens is now at the center of the crisis, and Mola Lenghi is there. Mola?
Well, Nora, in just 24 hours in New York City, 100 people have died due to the virus. Across the state, 1,200 people are currently in ICU. Medical staff, from doctors to nurses to EMTs, they're struggling to keep up with the influx of patients, and nowhere is that illustrated more than this hospital here.
Today, the crush of patients at Elmhurst Hospital was so overwhelming that 50 additional workers were sent there to help. Some of the sick are being transported elsewhere. This after 13 people died in just 24 hours at Elmhurst. EMT worker Anthony Almohera.
From the perspective of being properly prepared, the training is there, the equipment is not.
They all have COVID.
This doctor's video, posted by the New York Times, illustrates the bleak picture.
I don't really care if I get in trouble for speaking to the media. I want people to know that this is bad. People are dying. We don't have the tools that we need in the emergency department and in the hospital to take care of them.
Makeshift morgues are being set up at city hospitals. Across the country, more than 1,000 have already died. A review by the Washington Post found that 65% were over 70 years old and 60% were men. In Michigan, this emergency nurse sounded the alarm.
I didn't choose nursing or the healthcare field to not help people, and that's exactly what the choices are that they're giving us. They're giving us no choice but to help only the people that they think that can survive.
But the sick keep coming. In Chicago, a blunt warning from the city's mayor.
We could be expecting upwards of 40,000 hospitalizations.
Parts of the U.S. prepare for the worst of the COVID-19 pandemic this week. The country's medical workers are suiting up and going to work on the front lines.
I'm wearing my own mask that I have purchased online, and that's just to save enough PPE for everyone else.
Those drastic steps necessary to fend off a virus that's proving to be deadly for healthcare workers. Detroit nurse Lisa Ewald had been caring for COVID-19 patients only to contract the virus herself. She died just days later. Her hospital releasing a statement saying, in part, as healthcare providers on the front lines of this pandemic, we know we are not immune to its traumatic effects. But with skyrocketing case numbers and an apparent shortage of supplies of essential equipment,
I quit my job today.
Some healthcare workers, like Imaris Vera, say the risk has grown too great.
This isn't going to get any better. America is not prepared, and nurses are not being protected.
Amy DeLine, an ER nurse at Sinai Grace in Michigan, sharing the heartbreaking reality healthcare workers are facing across the nation.
We're losing a lot of patients quickly